Hello and welcome to See Outside the Box with myself, Dr. Sylvia Jones, the Queen of Vision. I have been an optometrist for 17 years and I'm also the owner of Divine Family Eyecare. And here at See Outside the Box, I'm here to serve as your guide through this eye care journey. A Divine Family Eye Care, at Divine Family Eye Care, we believe that everyone deserves great vision. And See Outside the Box is your weekly passport to clarity. Join us every week as we seek to unravel the mysteries of eye care, bringing awareness to topics that matter to you, while also providing just a little bit of divine insight. So get ready to see outside the box. So let's jump right into it. Today, we are going to explore how your routine eye exam holds the key to unlocking some secrets about your heart health. Your eyes just might be the windows to a healthier heart. So you're asking, what is this ocular cardiac connection? There is a fascinating link between your eye health and your heart health. And so today we're going to explore some of the signs your eyes can provide as far as early clues to potential cardiovascular problems. All right, as an eye doctor, many people, or when I talk to people, I don't believe that the general population knows that the eyes are just a part of they don't understand that as being a part of the overall body. Sometimes the eyes can provide clues to the rest of the body. And even though I don't see the rest of the body, if I see something happening in the eye, is a pretty good assumption that is happening all over your body. So during an eye exam, a lot of times you'll go and you'll get the drops. A lot of people don't like what we call the drops. They sting a little bit. They make your vision a little blurry. And then a lot of times they also make you light sensitive. But when we dilate, and what is dilation? It basically just opening the pupil so that we get a bigger window to look through. Then when we look in, we can see with just those little drops, we can look directly at the vessels in your body. And yes, they are eye vessels, but these are the vessels in your body. And then you don't need an x-ray, you don't need a fancy MRI, you don't need any of those things because the eyes provide a hole or a window called the pupil that we can open up and I can look directly at the vessels in your body. And what I see in those vessels is like a sneak peek into the rest of the body. I can make some assumptions that if these are the vessels, they are not any special vessels, they are in the back of your eye. But that if it's happening to these vessels in the back of your eye, then it may be happening and most likely happening to the vessels all over your body. So when we open that pupil and I look at those vessels, give me some very good clues as to the heart health because they are part of your vascular system. As we go through the next few weeks here, I'll be going over some of the things I might see that can lead me or your eye doctor to making some assumptions about your heart health, about maybe your cholesterol, about maybe your blood pressure. All of those things can affect the vessels in your body, the whole body. But because I can look in, take that sneak peek through the pupil, I can tell you what I see on the other side that will also give us a good indication on what might be happening with the rest of your body and causing things in your overall health. Isn't that wonder? Isn't that wild? Isn't that fantastic that an eye doctor, just by dilating your eyes, can see all of that? So that, my friends, is another reason why it is so vital for you to get an eye exam. So if you see, I hear this all the time, I got good vision. I got 20/20 vision. I can see. I don't need glasses. Why do I need to have an eye exam? You have vessels that need to be looked at and taken care of. So make sure that you are getting your annual. And because of this, because of what I have learned as an eye doctor, talking to patients, and I love talking to my patients, but a lot of times, over and over, is a running theme that many people don't know a lot about their eye health or the things to expect with their eyes along in the future. So this is why I created the Eyecare by Decade. It's just a small tool, a resource, and it's fun. Lots of nice pictures to go along with it. But just giving you insight on every decade of your life and what kind of to look for, expect in those decades. Now, it doesn't incorporate everything, but it does give you some of the bigger things that usually happen to most people throughout their life. And this book is not just for yourself, but it's also for those who you care about. So if it's your parents, your elderly parents, you can know what more to expect about them, or if you care for your children. Now, the thing is, you can go over to divinefamilyeyecare.com to get your copy of this free resource. Yes. And all of this is all about not just taking care of your eyes, not just taking care of your heart, but taking care of your whole body, so that you can live out the wonderful life that you were intended to live and enjoy. So make sure you tune in next time where we're going to talk a little bit. We're going to go a little deeper. We're going to dive a little deeper into some of these heart issues, some of these things that I can see inside of the back of the eye and what they indicate to me. So until next time, make sure that you see outside the box. Bye.